Welcome to the City Current Show. I'm your host, Andrew Bartolotta. We're always honored to bring you inspiring stories of individuals and organizations making an impact, empowering the good in our community and around the globe. Today, we're talking about Our Kids, a Nashville nonprofit that provides expert medical evaluations and crisis counseling in response to concerns of child sexual abuse. Joining us from Our Kids is their executive director, Sue Fortwhite. Sue, thanks for coming on the show.
Thank you for having me, Andrew.
Absolutely. Now, I briefly touched on what Our Kids does in the intro, but dive deeper into the mission of Our Kids and its history.
Well, Our Kids is 35 years old this year, and our theme has been Courageous Together, because it takes all of us to protect children and keep them safe, and also respond appropriately if something's happened to them. So we do provide expert, trauma-informed medical evaluations and crisis counseling in response to concerns about child sexual abuse. And we are very proud of the fact that Our Kids features a multidisciplinary team. So we have nurse practitioners and social workers working with every single child and family. They are also on call 24/7. So it's very rare that you have the experts sharing call coverage. And that started a long time ago, a lot longer. I've been here for 16 years, so it predated me. And I asked one day, I said, doing call coverage can be a burden. And it's, we have triage guidelines, et cetera. Why did we start that? And so the unanimous response was children and families were languishing in emergency departments, all the time, because this is a medical technical subspecialty. You have to know what you're looking for. You have to know all sorts of things about pediatric anatomy and evidence collection and all sorts of things. And really, it's the real answer is being on call 24/7 is the most compassionate thing that we can do. And one of the things, Andrew, that's different about child sexual abuse from, like, for instance, adult sexual assault is that, over 90% of the time, the perpetrator is someone that's known and trusted and sometimes even loved by the family or the child. Pre-pandemic, a normal patient volume for us was like 850 children a year. And that makes us one of the largest medical clinics of our kind in the country. We don't do anything else but evaluate for child sexual abuse. But you can imagine when a family comes here, sometimes it's one of the worst days. In fact, most of the time, it's one of the worst days of their lives. Whether the sexual assault to the child just happened last night or 2 days ago, or whether the child has disclosed to their caregiver that something happened 3 months ago or 6 months ago, it is a crisis. It is a moment that causes so many feelings and so much chaos. And, so we are here to meet the child and the caregiver where they are, what they're feeling, and what they're needing. And, an appointment at Our Kids is not a 20-minute medical transaction. It's actually a really intense encounter that lasts between an hour and a half and sometimes 4 and 5 hours. We had an emergency recently that took 5 hours. Wow. For a number of different reasons, because DCS was involved, law enforcement was involved. It was a very complicated case. And so really, it is about meeting the child and the family member, the caregiver, dignifying and respecting where they are. And, sometimes the caregiver, they are feeling so many things. They are feeling shame, guilt because they couldn't protect their child, confusion. Sometimes they're not believing, which is a very, very difficult thing for staff. Because our whole thing is believe and protect your child. And if you believe and protect, chances are the family can get on their road to healing. They can develop resilience together. Why would you have seen this coming, that your father did this to your 6-year-old little girl, or your brother? did this, to your 8-year-old little boy. And so it's complicated. And a lot of times we give people space, place, and time to feel whatever they're feeling, to share whatever they want to share. And we call it coming to ground, because it takes time for people to sort of recalibrate. And Andrew, a lot of times it happens more than twice a week here that the caregiver says, I have never felt this safe, and I've never felt this dignified. And I'm going to tell you something I've never told anybody. It happened to me when I was 5 and it was my grandfather. Or it happened to me when I was 11 and it was my older cousin. And sometimes, the social worker will ask the caregiver, sometimes if they don't give a detail like, this happened to me, I've never told anybody. Sometimes they say, I told and nobody believed me. And I will tell you, Andrew, that is soul crushing. And, our kids 5 years ago did a campaign called What If I Told You? And it's on our website. It's a beautiful 2-minute video with an incredibly powerful voiceover. It's linked to a website with all sorts of national resources, to the Child Advocacy Center closest to you for help for adult survivors. And one of the reasons why I wanted to do that campaign, there are millions of adult survivors out there, and they are so courageous. And the kind of what we talk about with the child and family, and with anyone we talk to, is it is never too late to heal. And the child and the family does not need to be defined by this sexual assault. And resilience. Resilience is there if you are believed and protected, and if the family gets the support they need. And that's why people that work at Our Kids, it's a calling. So for all of us, and sometimes it's all hands on deck because we have emergencies coming in. I mean, this is an emergency situation. We're handling emergencies all the time, but people work here and they stay here because it's an incredibly restorative place to work. And because we know that we plant seeds of hope. We know that we are affirming, we're saying to the caregiver, Mom, look at all the things you're doing right. Let's look at this. Let's look at how beautiful and how bright your child is, and I know I'm sort of going on, but I'm so passionate about this. And we had a child and mother come in one day, and she brought her child. She said, I'm believing, I'm protecting. She's never going to see that man again. He's never going to be around her again. And she looked at the nurse practitioner and said, it happened to me, and I wasn't believed. It happened to me when I was a little girl, and it was my grandfather, and nobody believed me. And the nurse practitioner in that moment said, look at what you're giving your child. You're giving your child what you needed so much that you never got. And look, you're here. You're getting her expert care. We're gonna help y'all recalibrate. It's just really it's a really beautiful, life-giving place, really.
Well, it really is a light in someone's darkness to be able to find a safe place where they can find that help and hope, like it says behind you. What are some of those signs of child sexual abuse?
So that's a great question, Andrew. I think that some of the signs that we typically think of, if you have a small child that is demonstrating knowledge about sexuality beyond their years, if you have a child who is suddenly, an outgoing, happy child who's suddenly very withdrawn, who is all of a sudden their behavior and their affect is significantly different. If you see regression where they are, wetting the bed and they've been toilet trained for years, fear around certain situations or around certain people. And, one of the things that that we always talk about is with the caregivers, whether it's the mom, the aunt, the grandmother, the father, is that one of the most important things is creating an atmosphere in your family so that the message to your child is, you can come and tell me anything. I'm not going to get angry with you. If something scares you, if it confuses you, or if it makes you feel icky, come and tell me, and we're on the same team. I love you. And it's my job to help keep you safe and to help sort of understand your world. And so with that kind of an openness, because I think that children are really afraid of adults' really large outbursts and emotional, the anger that can easily pop up, and we just need to be mindful that that's really scary to children. But I just feel like if it's the openness. The other thing that we have seen emerge, it's an emerging topic that's been emerging for about 8 or 10 years. The frequency of online targeting children and adolescents, and people are pretending to be a 14-year-old boy and they're really like a 32-year-old man. And children, we see it all the time. I mean, it's terrible. On our website, ourkidscenter.com, we have a piece of collateral that's talking about keeping kids safe online. And one of the most important things is just having communication with children and supervising, their handheld devices.
Now, you do have an upcoming event. You have Soup Sunday coming up on February 19th at Nissan Stadium. Talk about what that event is, the history, and what people can expect, as well as where to purchase their tickets.
Okay, so this is so exciting. I'm so glad you asked me, Andrew. So this is our 30th annual Soup Sunday. And our title sponsor is Ford, and our presenting sponsor is US Foods. And this is when 40 restaurants come to Club Level West, and they bring 10 gallons of their soup. And we have culinary judges and we have celebrity judges. And it's actually a really, there's a well-respected soup tasting in that way, but then we have all these guests that come, and you get a tray and you get these sample cups, and you can go around to all these restaurants and taste their soups. And it is so festive. And we have all of these Disney characters that are all in garb, and we have Star Wars characters, and we have mascots, and the children just love it. And it's really a wonderful family event, and no one ever leaves hungry, and it's just for a great cause. And I can't believe that we've done this this is going to be our 30th year. And the restaurants in this town, they're so generous, and it's usually their day off, and they love coming out. They love, certainly after the pandemic, they love being in front of the public again. And we're limiting the ticket sales to 1,200 guests because we don't want to overdo. And we got some feedback. We listened very carefully to our guests, and they told us several years ago it got too big, and so now we're scaling it down a bit so that it's a little bit more spacious and more enjoyable for everybody. But the restaurants are awesome community partners to us.
That's great. And what a fun event, like you said, supporting such a worthy cause. How can, what are some other ways people can get involved with your organization? Through volunteering, through their company, monetary donations? Talk about how people can get involved.
So we love volunteers, and we use over 200 volunteers a year. We love our corporate sponsors because they really keep the doors open here. We need their financial support. We also have people that do toy drives, because after every exam, the child gets to choose a brand new toy and a brand new book, and that's sort of part of our secret sauce here. And at the end of the day, Andrew, no matter what has happened to the child, they're still a child, and they get so excited to get to choose their own toy, a brand new toy. We love corporate sponsors. We love volunteers. We do use many volunteers at Soup Sunday. We also have Hammer Down. It's a 5K race that's going to be on April 1. So we do things throughout the year, but I think the most important thing is for people to educate themselves about the issue And if a child discloses to you, to know how to field that appropriately, how to respond appropriately. We have all sorts of great, very straightforward collateral material on our website, ourkidscenter.com. And also that's where you can buy Soup Sunday tickets.
One more time, where can people go to learn more about Our Kids, download those resources, purchase tickets to Soup Sunday, and find additional resources on child abuse and support your efforts?
So it's www.ourkidscenter.com.
Sue, thank you so much for coming on the show today.
Thank you, Andrew. It's been a real delight.